Right. Good morning, friends. So, in this session, I'll be speaking about the topic that is pharmacokinetics. Under the pharmacokinetics, the first thing we'll be starting with absorption. So, before going in detail regarding the points written here, we need to understand the meaning of absorption. And what do you mean by absorption? Absorption is nothing but it's a process of absorbing substance into the cell across the tissue or organs, either through diffusion, right? And you have other mechanism of absorption we'll be dealing like. So the simple thing we need to understand, absorption is the process of absorbing the substance into the cell, okay, or across the tissue or organs through diffusion, okay. So we need to understand the other important points written here, that is pharmacokinetics and pharmacodynamics. But today we'll be discussing about pharmacokinetics. And what do you mean by pharmaco? Pharmacon I have already discussed you, it is a drug. What do you mean by kinetic? Kinetic is kinesis, right? Pharmacokinesis. And we should also understand what drug. So, what happens to a drug in the body, right? The moment you take the drug inside, pharmacon, where actually the drug goes inside the body, that is kinesis, right? And this is derived from Greek word, right? It is derived from Greek word. So it's also written that pharmacokinetics, what is that? Pharmacon, it's a drug. Kinesis is the movement. What exactly, where exactly the drug moves? Movement of drug in the body, right? If you see the difference of the pharmacokinetics with the pharmacodynamics, right? What is pharmacon? I have told you it's a drug, right? Dynamics, it is dynamos, means change. So if you see the definition of the pharmacodynamics, pharmacon is a drug, right? Dynamics is the change. That means drug induced changes in the body. Say example, you have taken the drug, right? Antihypertensive drug. The moment you take the drug inside, it absorbs and goes to the respective receptors. The moment it acts on the receptors, what happens? It decreases the BP. So this drug induced change, which drug? Antihypertensive drug. What does it do? It is decreasing the BP. So drug induced change in the body is pharmacodynamics, right? So let us discuss regarding the pharmacokinetics in detail for the rest of the time. So the first thing written here is you have something known as oral drug, right? Now the moment I take the drug inside, right? The moment I take the drug inside, it goes absorption, and it's also written that systemic circulation, right? Then you have there's something known as remaining drug. You have a target, you got an effect. There's something known as drug distribution. You have redistribution, and you have liver. Then you can see like a metabolism. Drug is broken down, and you can also see water soluble secreted back into the circulation or plasma, kidney, and excretion. So what are the basic points you need to understand regarding the pharmacokinetics is, we need to understand you have something known as absorption, right? And you even have something known as drug distribution, right? And you have something known as metabolism, and you also understand you have something known as excretion. So these 4 points, that is absorption, distribution, metabolism, and excretion. What is it trying to tell us is, so now the drug, the moment you take the drug from the oral route, it goes into the stomach, right? So stomach, in the stomach you can see there is an absorption, right? From the stomach it goes into the duodenum, right? If you observe carefully, and this is small intestine. Now the drug is present here, right, from the stomach, and there is also a absorption from the small intestine into the bloodstream. So this is an absorption, it is absorbing, our body is absorbing. So this is the first topic, first point. From this absorption, if you understand, you have a blood vessel over here, so it goes into the blood stream, that is distribution, right? That is distribution. From the bloodstream, from the bloodstream, it can go into the different parts of the body, right? And it can go to the liver, and that can go for the metabolism, and the drug is broken down, and that can leads to a water soluble, right? Now we should also understand the bloodstream, right? The moment this, what is this is what, this is a water soluble, right? It can go back to the, this is present in the blood itself, right? Everything in liver also you have a blood, so from the blood it goes into the kidney, and there you can see the excretion of the urine, right? So that's the basic point is trying to tell us regarding the absorption, because this is very important to understand. So the first thing is absorption, absorbing from the GIT or small intestine. From there it can, you can see this, you have gotten blood vessels all over the this intestines, right? It can go to the liver, it go to the liver where the metabolism happens, where the drug is broken down and it convert into water soluble, and the water soluble drug, it is secreted back into the circulation of the plasma. From there it goes to the excess, it has goes to the kidney, and there is an excretion. And the systemic circulation, right? So from the systemic circulation we need to understand, that means where exactly in the blood it can go into the different parts of the body, that is a drug distribution, okay? That is a drug distribution, right? Drug distribution. So that's all you need to understand. It's also written that you have got something known as remaining drug, target, and effect. After the absorption, after the taking from the systemic circulation, when it goes into different drug distribution, goes into different parts of the body, right? So the remaining drug, we should also understand not only the other parts, the remaining drug, it goes to the liver also, okay? And the remaining drug then reaches the target from the systemic circulation. Now say example, I need a drug where say if you understand, I need a drug suppose say my back is aching, okay? I take tablet paracetamol or diclofenac. So the moment I take the tablet diclofenac inside, it is absorbed in the stomach and intestine, and it goes into the blood and goes into the all over the body, okay? That is a drug distribution. But we need back, right? So systemic circulation, it goes to the remaining drug, if you understand, it goes to the back and it cures it, okay? So that's all you need to understand. Systemic circulation, redistribution, systemic circulation, redistribution. Also understand, remember, goes into the liver, metabolism, and water soluble, goes into the kidney and excreted. So we need to understand there are few important basic points to understand what exactly this does. Okay. So if you observe carefully here, the remaining drug reversibly binds to the target. Okay. It will be distributed to all the tissues. To get it will be redistributed. To get redistributed, drug must have very high lipid solubility. Drug should be very short acting, right? So what is it trying to tell us? Now, if you observe this, there is something known as, which we have already discussed, the remaining drug. Okay, I have told you the remaining drug acts on the target and it leads to the effect. Now this remaining drug reversibly binds to the target. It will be redistributed to all the tissues, so that, suppose, say example, if this is the target, okay, and this leads to the decreased BP, right? Now I have a drug here, it goes and bind to the receptor, and this drug should be reversibly, it should not be irreversible, because if it is irreversible binding to the receptor, it continuously lead to increased BP. So we need something known as reversible. Okay, remaining drug reversibly binds to the target, it will be redistributed to all the moment it reversible, it goes to the different tissues. Now we need to understand, to get the redistribution, that means to get the redistribution, what are the major points we need to understand? That is, drug must have very high lipid solubility, drug should be very short acting. If the drug was not, right, if the drug was not undergoing, if the drug was not undergoing redistribution, it would stay bounded to the target and becomes long acting. Example, thiopentone is purposefully combined with sulfur to make it lipid soluble. Hence, it produces quick effect and is also short acting. In the kidney, plasma plus any water soluble substances are filtered. Thus, the water soluble drugs is filtered along with the drug in the plasma. So we need to understand that two basic points. So what are the two basic points here? One, there should be an very high lipid solubility, very short acting. Further, to get the drug redistributed, it should be high lipid soluble, because it can go from different parts to different, and short acting. So why it is short acting? Suppose if it is a long acting, I have already told you, so it will becomes the long acting. Okay, so that the long acting means it shows the effect longer. So they have given the example like thiopentone. So thiopentone is purposely bound with sulfur. Okay, that's why you get in the brand you get something known as thiopentone sodium. So this thiopentone sodium, what does this thiopentone sodium? You need to understand. The moment you take IV administration of thiopentone, so it is distributed. Okay, it is distributed to a rich blood supply like brain, and it start inducing the anesthesia. Now what happens here is, there is a redistribution to less well perfused tissue, right? Then termination of induction, redistribution to poorly perfused tissue, elimination by metabolism in the liver, metabolites excrete in kidney. So we just remember that for the thiopentone is purposely is combining with sulfur. That's all. So we should also understand the kidney plays a very important role for the elimination of the any soluble, water soluble substance. Okay, so that it can prevent the toxicity in the blood and can excrete out the metabolites. Okay, so any water soluble substance, the moment it metabolizes in the liver or the kidney, what happens here is the metabolites, they excrete out water soluble. Okay, so, and the main purpose of these pharmacokinetics, it is what the body does to the drug. Okay, mnemonic you have, that is ADME, that is absorption, I have told you. Then we have told you the moment it absorbs from the stomach and the intestine, it absorbs, it distributed into the blood vessels. So the remaining drug goes to the liver and it metabolizes, I have told you, right? The remaining drug goes to the receptors and it can show the effect. The metabolites, the water soluble metabolites after the liver metabolism in the blood, since they are present in the blood itself, they are excreted via the kidney. That's all we're going to discuss in the further sessions. And they have already written here, What did they derive, babes? They wrote something as pharmacodynamics. It is what the drug does to the body. Okay, that means like the moment you take the drug inside, right? The moment you take the drug inside, what happens here is it goes once it reaches the target. The moment it reaches the target, what happens once it reaches the target? It can uh, what it shows the effect. Okay, so either change in the heart rate or respiratory rate, and efficacy is the part of pharmacodynamics. We'll be discussing about what is the efficacy, all that in the further sessions, but time we need to understand these are the four basic we need gonna understand. Thank you.